Okay, thanks everyone for being here. We'll go ahead and get started. My name is Colleen Campbell. I'm with the Max Planck Digital Library in Munich, Germany, and I coordinate the Open Access 2020 initiative. I'm joined by a panel that I will introduce as each of them is called to speak, okay? So right now they remain mystery guests. To get things started, a quick question of you all. We're talking about transformative agreements. How generally transformative are they? Oh, right, sorry, I'm being reminded we have a couple announcements. First of all, code of conduct. You all should have read that in your app, so please abide by the code of conduct. Later on, we will have plenty of time for questions, hopefully. And when we come to the questions, we ask that you go to the mic, introduce yourself, and then pose your question, okay? All right, back to the task at hand. Just to understand if we need to go through any definitions, raise of hands, how many of you have actually signed or negotiated a transformative agreement of some kind? Okay, so yes, great work. So we don't need to define anything here, it seems to me. So transformative, I'm sure all of the agreements that you have signed might go by different names, read and publish and read, et cetera, et cetera, et cetera. So why this umbrella term transformative? Well, transformative means having the power to transform. So why do we need to transform anything? I mean, just a few reasons. There was already 20 years ago this call for open access to the results of research. We have the OSTP memo, of course, from last year. Other aspects that are very dear to libraries, I think, are the fact that increasing spend on hybrid open access publishing, author-facing fees for the most part. And then generally, if you look at the landscape, to see the growth of fee-based open access publishing really brings libraries to think about, okay, how do we prepare ourselves for this new paradigm, also publishers, for this emerging open paradigm in scholarly communication. So with that, this power to transform, let's see how we're doing. Transformative agreements in the ESAC registry. If you have an agreement and you are a librarian or a staff member of a consortium, please make sure your agreements are entered in the registry. It's a way of counting and seeing where we are in terms of progress in the open access transition. Back in 2018, when this notion of transformative agreements was first really validated by the research community at the Berlin Open Access Conference, we had around 34 agreements, 9 countries. Something started out small, but already today we can see that there are hundreds of agreements negotiated in more than 70 countries, more than 60 publishers actively engaged. In terms of what are the outcomes of all of this work, back in 2018, you can see that's the number of articles published openly or enabled to be published openly under these agreements. And today, more than 1 million articles immediately available. Looking at how different research communities are, the progress that they are making on an individual level within their countries, we can see the first movers up in the Nordic countries in Europe who have achieved, you see in the peachy color there, is their research output enabled open access thanks to transformative agreements. So you see, added on to the gold proportion, which is fully open access publishing, they're already reaching 75, 80% of their countrywide outputs open access. Now that's back already in 2018, 2019, even 2016, they were achieving these levels. Newcomers who've only started negotiating these agreements in the past few years, 2020, 2021, 2022, you see the impact that these agreements are having for them. So that's a bit about how it's really transforming the landscape. But now I would like to call upon my panelists who are going to present different perspectives on how transformative agreements are transforming things in their own contexts. So I'm going to start with Brigitte Kromp. Brigitte is one of the most experienced negotiators I know. I think you probably negotiated the first transformative agreement in absolute. So Brigitte is head of the Austrian Central Library for Physics and head of the Department of Consortium Management at Vienna University. So tell us, Brigitte, about your perspective on transformative agreements and how they are transforming things.
Yeah, good afternoon, and thank you very much for the introduction. And I want to start, or let me start with answering the question, so to reduce suspense. So the question is, how transformative are transformative agreements? And the answer for Austria is they are really transformative. So if you look at the graph, you will see that since 2015, we had a more or less total turnaround of the way we publish. In 2015, we started with the first transformative agreement with the Institute of Physics. And in this year, we had more than 80% of the articles were published closed. Today, and we have 18 transformative agreements concluded in the framework of the Austrian Academic Library Consortium. More than 85% of the articles are published open. So how could this change happen? I think in Austria, we had three crucial preconditions. So first, the most important funding organization for basic research has established a mandatory open access policy already in 2015. And unlike like most of the other funding organizations, our funder also financially supports open access publishing. Secondly, also in 2015, the Austrian Academic Library Consortium determined that all renewals had to start as negotiations for cost-neutral transformative agreements. And third, in 2017, a project supported by the Ministry of Research has been launched, in which all Austrian state universities participate, and this is called Austrian Transition to Open Access. And this project really does what the name promises. It helps the universities to go the transition from closed to open access publishing. This starts with initial funding for new transformative agreements, but we also have a lot of working groups that work to open access related topics. For example, we develop proposals for new cost, for new rules for open access costs for our accounting departments. Or we have a working group on predatory publishing, because this topic was often mixed with open access publishing, predatory publishing. So you see, we help to support the transition in various areas. But I also want to emphasize that the way to realization of this status was not always easy to go. So it means that you have a lot of conversation and discussions with decision makers, but also with colleagues. We see a lot of challenges waiting for us in the next years, and I do not want to finish, although I think yeah, okay. It's like driving. Always the second makes the cue. So, the biggest problem that we see at the moment is reallocation of costs, and I mean this on several levels. First, on a national level, that means a new allocation of costs between the institutions. Second, on a global level, so between countries, and we have this hot topic equity. But we also see a third, and this is a new allocation between fully gold open access journals, and a lot of them are now really launched by publishers, and it means that we have to pay a lot of fresh money for APCs, and then not so decreasing amount of costs of money for the transformative agreements. So there is a lot of challenges before us, but at the end we are really optimistic that open access has come to stay. Thank you.
Thank you, Brigitte. Okay, now to contrast sort of a European perspective, one with many years of experience, we have Jason Price, who is Research and Scholarly Communication Director at the SCELC Library Consortium, which serves small and mid-sized private academic and research institutions in primarily California, I think. He manages now 6 transformative agreements, which include more than 200 subscriptions across 100 institutions. So how do you see things transforming in your context?
Okay, I'd like to basically show evidence of 2 forms of genuine transformation. The first probably won't be a surprise to many of you in this room at all. On the x-axis is time, and on the y-axis is the number of articles. Can you guess which year this agreement became a transformative agreement? Right? That's when those that black line, that's the closed articles, dropped dramatically, and the orange line represents the combination of publisher-hosted open content. Goes way up. So it's really a hockey stick change. We know this happens, you know this happens at your institutions. But one question about how genuinely transformative are these agreements is, well, what about the publisher as a whole? Are they just going to continue to publish just as many closed articles, and that number is going to continue to rise, as well as the open articles rising, so that we don't actually transform this, we just add more open and more closed? So I looked at that for the same publisher recently using data provided by Dimension. So here you can see that closed article gray line at the top for 2020 through 2022 did slowly decrease as globally their open publication is increasing. So that is showing that that this publisher has enough open agreements that it is transforming it, and that closed publishing is actually declining. The question marks in red and there, I'll just briefly say, is it's 2023 isn't over yet. That's a prediction, and those changes look really big. So we'll see if that actually happens. But if you look at 2020 through 2022, you can see that globally this is happening, and that's exciting. Then the second way that we're seeing transformation is through a collaboration with a couple of other consortium, one of which does a lot of publishing. So when you look at the before, and you look at our institutions, which I put into the Reed institution pile here, we spent 60% of the total spend, and the institutions that did the publishing spent less than half of that total spend. So one of the things that happens to happen if these agreements are going to be truly transformative is the costs need to shift from those libraries that read toward those libraries that publish. Well, how is that going to happen? Are they going to be able to take on all that cost? It's pretty hard, right? That would be a lot. That's one of the big skeptical things, because if you look at how much we publish relatively, and if you shift that cost, they would have to take on a whole lot more of the expenditures. Well, the UC system, which is the published libraries represented here, has introduced a model called multipayer, which I won't go into now for lack of time, but it does involve adding author grant dollars in to help afford open publishing and to take on more of the costs for the institutions that publish more, because it's not just the libraries taking on the costs, but also the authors. So in 2023, we had separate TAs, and you can see sort of the division of the costs there. We have a model now that we're soon to announce that is actually going to shift for 2024 so that there will be a slightly greater amount of the costs taken on by the authors, and that will actually reduce the costs for the Reed libraries. So there is a slow transfer of dollars beginning to happen here if the model and its predictions work as we expect. And so this is a slow, gradual change, as it needs to be, but it's very exciting to me to actually see not just a transformation in what's available, but also a slow move toward having it funded based on the amount of publishing.
Thank you very much, Jason. Now, another perspective. Sometimes you might hear people say that transformative agreements, it's only for those big commercial publishers, and others, it's too hard for others to get involved. So we have Miguel Peralta, who is the institutional sales manager at Rockefeller University Press, which is a small biomedical publisher that publishes 3 highly selective journals in the life sciences. Miguel, what do you have to say on the matter?
Thank you very much. I'm going to scream at you. Gosh. So I have a naturally loud voice. So thank you very much for the introduction, and thank you all for attending. It's very hard to not be a truant on days like this and afternoons towards the end of a conference. So like Colleen was saying, I want to talk about sort of the positive effects of transformative agreements for us as a small biomedical press. That isn't to say that all of these transformations are necessarily inherently positive, and hopefully we'll be able to discuss some of the especially macro level challenges shortly. So I wanted to start off by showing a graph that is charting the percentage of OA uptake from 2017 when we introduced our open access option to today. And I want to highlight in particular the United Kingdom and Japan, because these represent two different approaches to read and publish agreements that we have taken. JISC in the United Kingdom was our very first read and publish agreement, when we, as a small press, were taking tentative little baby steps towards actually participating in these agreements. And as soon as we offered an open access fee, 80% of authors were choosing it. So in a certain sense, this wasn't necessarily a transformation from paywalled to gold, so much as a transformation of, much like Jason was just saying, a fiscal transformation, a transformation from the author paying to the library paying. This contrasts with Japan, where we have taken a more proactive approach. Rather than being receptive and reactive to funding mandates, we have tried to precipitate funding mandates. And so in the case of Japan, we offered a read and publish that just started in 2023. And as you can see, it's a wild effect from 22 to 2023. You know, we had about 20% of authors in Japan choosing open access in the year prior to the read and publish, and that's gone up to over 80%. And I think this has proven to be an effective strategy, and I encourage other small publishers to also adopt this sort of proactive, progressive open access stance, because we've heard this week that it could very well be the case that Japan is also launching a mandate in the near future. The third transformation I want to talk about that is reflected here, though, is collectively shown by all of these lines, and it is actually the most important transformation in a lot of ways. It is the transformation that is motivating all of this and that started all of this, which is the transformation of authors increasingly choosing open access options. So this is best evidence in the United States. 50% of our articles come from the United States. And I apologize, I realize we're all sort of throwing a lot of stats at you. But 50% of our articles come from the United States. And from 2017 to 2020, consistently 7% of our authors chose to publish open access. Not including read and publish articles, from 2020 to 2021, that increased 3 times, from 7% to 18%. From 2021 to 2022, that increased to 28%. So it's something that it's almost marginal to say that, you know, well, not marginal, but you know, this is not necessarily a transformation that we as publishers are responsible for, or that librarians are necessarily responsible for, but it's ultimately something that is being driven and necessitated by these researchers. Even though we do see a bit of a minor dip in certain regions from 2022 to 2023. So all of these stats have really enabled us to increase our open access share and to, in particular, do something which is really exciting for us as a very small publisher. We are a very traditional publisher. In a lot of ways, we are like a library in that we are a department of a university. And we don't typically grow. We don't, you know, we're not like a big publisher that has 100 titles coming in a year and 100 leaving. We've had 3 titles, and so open access has also been a way for us to engage with the community more and to actually have something new to talk about with people, which has had a really strong effect. So, you know, we're up to 40% open access, and 20% of all of our articles are published through these read and publish agreements. And over half of our open access articles are published through them. So there's still a long way to go, absolutely, but I think these transformative agreements have really moved the dial and have really provided small publishers like us real benefits. Hand it over.
Fantastic.
Carrie.
Thank you very much, Miguel. Yes, Carrie. Yes. A lot of support there. That's wonderful. Carrie, now another perspective, this time from a large commercial publisher. Carrie Webster is Vice President of Open Access at Springer Nature. Carrie.
Thank you. Can you hear me okay? No. Okay. I don't. There we go. So I just want to share a bit of Springer Nature's journey with transformative agreement. So what I'm showing on the screen is some numbers from 2018 and where we expect to be at the beginning of 2024. My key messages and the changes that we see in this time is really that of volume and scale, but also regional, so really aligning, I think, with what you've already heard. But talking about what that means from a publisher's perspective, in 2018, if you look at the volumes that we had, we were supporting about 300 institutions through transformative agreements. We had 6 agreements. And now we're expecting at the beginning of 24 to have 48 agreements, but supporting over 50,000 publications going through transformative agreements and over 3,500 institutions. And why this is relevant, this scale, is, I'm proud of the numbers, because there's nothing like scale to really test if you've built the systems properly. And I think we were keen to support our customers. We were keen to do open access and do those agreements in the early days. But it actually internally has meant a lot of infrastructure building to make sure that we really meet the needs, but also that we are not just hiring lots and lots of hamsters behind the scenes to make it all work. So that, from a publisher's point of view, building the infrastructure, the IT investment, is a really big part of the transformation. But I think the more interesting part is on the regional aspect and what that's meant for us. So in 2018, as you can see, most of our customers were what you might think of as early OA adopters, the countries within Europe. But now, I would say it really is truly global. Customers in Egypt, Japan, the US, really all over, which is great for the transformation, that it hasn't just become what was a risk maybe at one point, quite Europe-centric. But it's really meant demonstrating that one size doesn't fit all, really recognizing that different regions have a different path to the transformation. And that was something that we've really had to adapt to along the way. Colleen mentioned different flavors of transformative agreements. And so we have a read and publish model, and within that, there is many, many flavors. And I just want to speak to some examples of what that means for us. Different countries have different tax treatments of what that means for an APC, so that affects their funding, the contracts. Some countries might want to do, or customers might want to do partial coverage. Some might want to do complete coverage. Some might want to give themselves a buffer for growth. Others really only want to be very specific on certain numbers. Jason mentioned multi-pay, which I think is really, really important model. We haven't seen it scale, but I think it will do, bringing in different funding streams. We had to build that. We had to work out what that means. Are we identifying authors, funders? What can we do? Just the different features that different customers want, that also has really varied. And I think a nice example of that is with approvals. When you do a transformative agreement, typically you want an institution wants to approve the articles. Are they from my institution? Make sure that they're funding their own researchers. So we developed our functionality for that. Very much this was a strong requirement that we worked on with the customers in Europe to make sure it was as robust as possible. When we started talking to customers in the US, they were like, well, actually, we don't have an OA team with lots of heads to approve articles. Your approval system is getting 97% of articles. I'm good. I want auto approval. I actually don't want that whole piece. I want you to have something else to make it easy. So that's been a real learning, that we've had to really be flexible as we grow. And I think as I look to the future, that's definitely what we know we need to keep doing more, as we're going to color in different areas of that map.
Brilliant. Thank you very much, Carrie. And finally, we are extremely privileged to have a researcher, a different perspective. Tony Baines. Tony is Associate Professor at the Department of Biological and Biomedical Sciences and the Cancer Research Program of the JLC Biomedical Biotechnology Research Institute at North Carolina Central University. Is that correct? And Adjunct Associate Professor at the Department of Pharmacology of UNC Chapel Hill School of Medicine. So what is your perspective on all of this transformation, Tony?
Thank you for that generous introduction, but I am definitely not anybody different from my panelists. We all are definitely awesome experts in our respective disciplines. First of all, thank you for the invitation to come here. I appreciate it. I am, as was mentioned, associate professor at North Carolina Central University, which is a historically black college and university in Durham, North Carolina, right down the street from Duke. I'm also a faculty member at UNC Chapel Hill, which is the flagship of all the UNC schools. So UNC is made up of 17 different schools. UNC Chapel Hill is the flagship, and then there's many other institutions such as NC Central that make up the UNC system. I'm a cancer biologist by training, specifically a cancer pharmacologist. I study pancreatic cancer, and forgive me for providing a little commercial, but November is Pancreatic Cancer Awareness Month. Pancreatic cancer is the third most common cause of cancer deaths in the U.S., and unfortunately, in 2030, it's believed it's going to become the second common cause of cancer deaths in the U.S., and nobody knows why. So, just want to encourage you all to stay on top of your health care. Get checked out if there's anything that feels weird. Pancreatic cancer is very lethal for most patients. It's lethal because we can't detect it early. And there's really no good treatments. And so my research focuses on trying to find novel targets to make drugs against to treat pancreatic cancer. I say all that, one, because I want to make you aware of again, November Pancreatic Cancer Awareness Month, but also the importance of making sure that the research we do as biomedical researchers get out to the public. A lot of times we write papers for other scientists, but really we need to get this information out to the public. And so just one of the pluses of open access is being able to get that information out to the general body with the hope of helping improve healthcare overall throughout the world. So I just wanted to just kind of bring to your attention that I think we need to keep in mind when we talk about these transformative agreements and open access, we need to think about we need to keep in mind that universities are not homogeneous. Again, I think a lot of times we just sometimes think of universities as just one big black box, and all of them are the same, but they're not. And I can attest to that by working at two different institutions. UNC Chapel Hill is a research focus institution, so their focus is research. Teaching is, of course, important in service, but if I guarantee you, if you ask most of the faculty there, research is the one thing that keeps them really busy in terms of their career. But I'm also at NC Central University, which is a liberal arts university, first state-supported liberal arts university for African Americans back in 1923. And so at NC Central, there's research definitely that we do. So research is definitely a big part of our of what we do. But we also focus a lot on teaching and service in the community. And so I think we just need to keep in mind when we talk about these open access and transformative agreements that not all universities are the same. UNC's research portfolio is much more funding and resources is much more than NC Central. And so we need to keep that in mind. So again, when you think about different universities, we need to think about also predominantly white institutions versus historically black colleges and universities, versus Hispanic serving institutions, MSIs, minority serving institutions. Again, they're all different and they all have different levels of support when it comes to grant funding. We also need to think about different types of research. So there's biomedical research, which usually brings in a lot of dollars, NIH funding, NSF, et cetera, and then we have other types of funding that's supported by foundations and corporations and different entities. All research is important, so one is not better than the other, it's just different and bring in different amounts of funding and support. We also need to think about, and we kind of talked about this a little bit with these different journals, with the plus of having open access, there are some negatives. And one of those negatives is, okay, how does that journal stay afloat? How does it stay alive? If we now are changing the funding model of these journals, and so a lot of researchers who are editors on journals have to consider that. How do you increase the submissions to keep up with the demand and cost of that journal? And then also, the last thing I'll say real quick is that we need to keep in mind that what may help in these cases with universities that have lower sources of funding and support, may try to find ways to increase alliances and infrastructure. So I think those are things we need to keep in mind as we move forward. And then lastly, excuse me, again, I think we just need to keep in mind that as we move forward with open access and transformative agreements, as was mentioned by my colleagues, money is a big player, and money tends, unfortunately, to separate out, those that have money from those that don't have money. And so I think we just need to keep that in mind. If we really want true equity, then we really need to keep those in mind. My colleague beside me was showing a map of different parts of the country, different continents that have been successful. And if you notice, there's not really that many countries in Africa or in South America. So Latin American and African countries, we don't see much going on in terms of, at least from that map, in terms of open access and transformative agreements. And again, I think that just means there's opportunity there, opportunity to make sure we don't leave those countries behind, just as we don't want to leave various universities behind as well. So I just want to again, I just wanted to come to you and just kind of just encourage you to keep those things in mind, that not all universities or researchers or countries are homogeneous, that we have different ones, and the ones that may not be fortunate in terms of having a higher revenue and funding support, we need to make sure that we bring those along as well. So thank you for your attention.
Thank you, Tony, for your brilliant considerations. I think you've provided lots of food for thought for everyone in the room. Thank you indeed. We have some potential topics for discussion, but we've only got about 10 minutes left. So I think the panel was hoping that we would have more of a conversation with folks. Yeah, and if you would like to, okay, I'm seeing comments already. I will